Good morning, dear colleagues. Thank you very much for the invitation for this magnificent event. Our work was dedicated to the impact of prior treatment with the 5-alpha inhibitor on apparent diffusion coefficient values in prostate cancer differentiation. This work comes from the Lviv National Medical University, Urology and Radiology departments with Ukraine, and also from Medical Center Euroclinic. I don't have any conflict of interest to disclose. As we all know, the European Association of Urology guidelines strongly recommend performing the multiparametric MRI in both biopsy-negative men and before repeat prostate biopsy when clinical suspicion of prostate cancer persists despite previous negative biopsies. And according to the Cochrane meta-analysis, this method shows pretty high sensitivity and moderate specificity in order to detect the clinically significant prostate cancer. According to the latest PIRADS guidelines, the ADC value plays a crucial role in defining and breaking the PIRADS category of the suspicious lesion located in both peripheral or transition zone of the prostate and in differentiation between the benign and malignant tumors of the gland. And also there is a data that ADC values play a useful role in the differentiation between the different Gleason score or Gleason patterns. Alpha reductase inhibitors, particularly 5-alpha reductase inhibitors, have been widely used for the treatment of benign prostate hyperplasia and lower urinary tract symptoms. They show a possibility to reduce the volume of the prostate when exposed from 3 to 6 months. And currently, the wide use of multiparametric MRI produced several studies that have investigated the effect of 5-alpha reductase inhibitors on MRI data in prostate cancer patients. For example, some authors reported that dutasteride was associated with a significant reduction in prostate cancer volume on T2-weighted imaging. However, other studies showed conflicting results in the change of quantitative parameters of prostate cancer. For example, the score detected that long-term exposure to 5-alpha reductase inhibitors do not seem to impair the detection of clinically significant cancer, but may affect the ability of ADC metrics to discriminate between the lesions that harbor significant cancer and benign lesions. The purpose of our study was to analyze the impact of prior lower urinary tract symptoms treatment with the finasteride on apparent diffusion coefficient values in prostate cancer differential diagnostics. This retrospective study included 204 patients with histologically verified prostate cancer or benign prostatic hyperplasia. We used truth biopsies, 12 cores. In 102 cases with prostate cancer and 70 cases of BPH, there was no treatment with the finasteride before the biopsy, and in 20 cases of prostate cancer and 12 cases of BPH, there was such a treatment in standard dose during at least 4 months due to LUTs before the biopsy, and the mean duration of the treatment was 0.6 years of exposure to finasteride. And also study included 15 healthy volunteers as the reference standard. The inclusion and exclusion criteria demonstrating on this slide, we use 1.5 Tesla scanner using 8-channel phased array without rectal coil, standard multiparametric MRI protocol according to the PIRADS last guidelines was applied. DVI was used with before the contrast administration, and this sequence was performed with using the high B values. Also, we use the Funk tool software for the ADC map generation and all measurement. Also, for the facilitation of the lesion location, we used, as shown on this slide, the fusion between the T2-weighted images and DVI, and also between the lava and positive enhancement integral post-processing. The Microsoft Excel and SPSS software was used for the statistical analysis. And in the result of our examination, there was no difference in mean ADC values between subgroups with the prostate cancer untreated and previously treated with the finasteride due to LUTs. And also we observed a significant difference in mean ADC values in subgroups with the BPH untreated and treated with the finasteride. There was no difference in mean ADC values between subgroups with BPH treated with the finasteride and some groups with a clinically significant and clinically insignificant prostate cancer without a finasteride prescription history. Also, there was no difference between mean ADC values in subgroups with BPH and insignificant prostate cancer where finasteride was previously prescribed. At the same time, there was a difference in mean ADC values, as it's shown on this box plot, in group with BPH and subgroups with an insignificant and clinically significant prostate cancer, where was no history of finasteride prescription. Also, there was a strong inverse correlation between the duration of finasteride use and the ADC value in subgroups of the patient with the prostate cancer and BPH. So, on this slide, you can see the detailed statistical characteristic of ADC values of prostate lesion in patients who received and did not receive treatment with finasteride and healthy prostates. So to conclude, the treatment of LUTs with a finasteride caused an overlap of mean ADC values in subgroups with BPH and prostate cancer, the result of which is a hindering of ADC application in differential diagnostics of the prostate cancer. Thank you very much for the attention, and I want to finally say thank you to all European colleagues for the supporting of Ukraine in these dark times. Thank you.